Jerry is a 78-year-old male in the clinic today with the chief concern of falling off a 3-step ladder onto the garage floor about an hour ago. He denies hitting his head or loss of consciousness. He reports difficulty seeing with his current prescription glasses. He also presents with an ongoing intermittent productive cough for 1 to 2 weeks with thick tan phlegm, difficulty taking deep breaths, shortness of breath, and tiring easily. Jerry has a history of hypertension, diabetes, COPD, CAD, hyperlipidemia, PAD, chronic kidney disease, CHF, and osteoarthritis. He denies any previous history of falls, dizziness prior to or after the fall, or any prior injuries. His blood pressure today was a little elevated at 146/90. His heart rate was 100. His respiratory rate was elevated at 24. His temperature was 100.04, 95% oxygen saturation on room air, and he had an elevated BMI at 29. He also presents with 7 out of 10 pain. On physical exam, it revealed a mild limp favoring the left side, 4 out of 5 strength in the left lower extremity. He had grimacing with left iliac crest palpation and abduction, and he had a contusion on the left iliac crest. His throat was mildly erythematous, and thin white exudate was noted postpharyngeal. He also had tender anterior cervical adenopathy. So the diagnoses for this visit include fall initial encounter and left hip pain. We will need some further workup to rule out a hip fracture, pneumonia, potential hemorrhage, acute pharyngitis, and visual loss. The patient is being transferred to the nearest trauma center for hip and chest x-ray, EKG, potential MRI, CT, and labs. The patient is to return the day after discharge for follow-up of symptoms, vision screening, and medication reconciliation. We will also assess for any lingering bacterial infection and the need for antibiotics during this visit if pneumonia is ruled out in the ED. And we also potentially will refer him to an optometrist or ophthalmologist for vision screening.